Hello, my Aloha tribe, and welcome to the Aloha Perspective, where you get a little bit of something and a whole lot of everything. Happy Thursday. It is Thursday. We're back with the same subject this week, and it will be rolling into next week. It is Suicide Prevention Month. So, and I believe Tuesday was World Suicide Prevention Day. So, yeah, that one got by me. But anyways, so yeah, I'm here, and today I'm going to talk about chronic pain. So I know I was going to try to squeeze all these into one day, but I think I'm going to separate them, and I want to keep the CPTSD and the PTSD together. And in those, I'm going to talk about like the child abuse, childhood physical or sexual abuse, which can oftentimes lead to CPTSD or, of course, domestic violence and so on. And then with the standard PTSD, which we not standard, but the PTSD, which we normally equate with veterans' mental health. So, anyways, I'm sorry, I'm a little discombobulated today. Today's a bit of a difficult day for me. It's been 10 years since my mom's passed, and I know when you think 10 years, you think, well, you should have moved on. It's been hard. So today is actually hitting me a lot harder than I thought it would. So I'm going to do my best, okay, to get through this. So I apologize if I'm a little more squirrely than I have been all week. This is definitely it's a very tender subject to speak on and to give my perspective on, only because I want to make sure that I do my best to give it the proper sorry, some of the things on my desk moved. We had an earthquake this morning. That I give it the proper and correct attention that it needs, but also the handle it delicately enough, because it is such a delicate subject. So I get a little nervous because I want to make sure I'm not saying anything out of turn or overstepping or anything that might trigger somebody. So having your own perspective means you're basically giving your own thoughts on this. But again, I want to treat it as delicately as I can, because it is such a hard subject to deal with in its entirety. So today, chronic pain. I got this from the clevelandclinic.org. So I talked about before fibromyalgia. There are other types of chronic pain, but the ones that are most common is fibromyalgia and, of course, CRPS, which is formerly known as RSD, which is reflex sympathetic dystrophy, and now, again, more commonly known as CRPS, which is chronic regional pain syndrome. So it does say, or I'm sorry, not chronic, complex regional pain syndrome. I can never get that right, but complex regional pain syndrome. So with RSD, I'm going to speak more on the RSD because I know more about that than I do the fibromyalgia, but I know fibromyalgia probably has very similar issues with it. I do know it is the more common form of chronic pain that people have, and it's not pretty. It can be very life-changing, just as CRPS is definitely very life-changing. And CRPS can actually be so bad that people really, there's not a lot they can do, because it's just trying to function, period, is difficult. And again, I don't want to take away from fibromyalgia. I don't want to take away from other chronic pain. I'm not trying to exclude them. Because older sibling has CRPS, I'm a little more informed on CRPS than I am on the others. So bear with me. But so I'm going to read what I have. I'm going to read a card that I made for sibling to carry with her, and I'm going to share a story as to where that card came from. So anyways, I couldn't really find a number, and I'm sure out there is a number talking about the suicide rate of chronic pain, but I couldn't find an exact number. However, in 2015, a study was done. 41,119 people took their own lives in the United States in 2015, which, if you remember the numbers from earlier in the week, that number has significantly raised. So, going into that, they couldn't solidly conclude. I don't know how to put that. But they believe that at least half of those suicides were from chronic pain. Now, I want to remind everybody, I am not a doctor. I am not a licensed anything. I'm just here sharing my perspective and sharing what I see, what I've been through, my own journey through this particular area of mental health, and what I see on a daily basis with my own sister, so my soul sister. So again, suicide rate for chronic pain patients in 2015 suggested that half the average of suicides were actually chronic pain patients, but it was hard for them to really kind of narrow that down if that is the case. Now, you know what? Just let me read all my stuff and then I'll get into the personal stuff. So oh, okay, sorry, that was CPTSD. I guess I don't have any notes on this. So I have notes for CPTSD. Oh, there we go. Sorry. It's a very short list of notes. That's why. Anyways, chronic pain and suicide. RSD or CRPS is known as the suicide disease because there is no cure. What is CRPS? So we'll talk about that when I read this. There are, now, part of the problem is there are opioid issues. Okay. Chronic pain patients need their opiates. Now, a lot of people say, no, they don't. They can just will it away. Now, look, I am a huge believer in spirituality. I'm a huge believer in natural remedies. I am a huge believer that there's a lot of things we can do that don't involve pills. But unless you have had chronic pain, you do not, I think it's, I don't want to say you do not understand. It's hard to understand what a person goes through and how these things are really kind of necessary. Now, the problem with opioids is people have gone and overprescribed it, overpushed it, and because of that, they kind of created this drug trend. So, and this addiction trend to it. So now, while the medical part is trying to regulate these things, and they're making it harder for the patients that actually need it. It is a triplicate drug. In case you want to know how I know that, I used to be a pharmacy technician in my other life. So when I was much, much younger. And so it's always been a triplicate drug. Whatever opiate opiates fall under a triplicate prescription. So, and in the old days, a triplicate prescription meant it was actually a triplicate form. But nowadays, I think it's just this special pretty form with lots of, if you try to copy it, it's going to come out black or whatever. You know how they do all this coding stuff now that it really kind of makes it hard to photocopy things. But back in the old days, that's why we called it a triplicate prescription, because it was 3 pieces. One was kept, I believe, I can't remember how it was. I think one was kept by the doctor. One was kept by, one had to be sent in. They had to be sent in. And then I think one was kept by the pharmacy on file. So I might be wrong on that. It's been so long. But part of the issues with chronic pain now is the issues they're having with the opioid crisis that's happening, because now the patients who actually require these meds are being affected. So I actually did a protest, my very first one, with a friend a couple of years ago and older sibling. I believe it was in front of LA's DEA office. I'm not exactly sure, that maybe the Drug Administration, but it was also next to Veterans Affairs. So, we're going to talk about them later. It was, but they go, some of them go through the same thing because their injuries can actually trigger these things. So let's get into that. RSD, I'm not sure, again, I'm speaking more to CRPS because I do not, or CRPS RSD. I'm going to try to start calling it CRPS. I do not know or have a lot of information on fibromyalgia. I do know a lot of people who have it, but I feel bad because I have not done the homework on fibromyalgia, but I have done the homework on CRPS, which again is complex regional pain syndrome, formerly known as RSD, which is reflex sympathetic dystrophy. So I was just talking about the opioid crisis and how a lot of the chronic pain patients are struggling and suffering and getting less of their meds that they need because of the regulations being put onto people who have become addicted to this. So there's that's going to need some work. That's going to take some time, and hopefully they get that situated or find a way that the chronic pain patients don't suffer. Now, just so you know, Sibling is with a pain management doctor. So that is a huge thing. Okay, she's not just going to some one-off clinic, trying to get tons and tons of meds. I'll get into her personal story a little bit as soon as I finish this list. But I really want that to be clear in a lot of people's minds, because a lot of people say, oh, well, they're probably just addicted. People are always going to have some kind of opinion and comment. And if you are a chronic pain sufferer, don't listen to them, okay? Opinions are like assholes. Everybody has one, right? So, and my favorite saying, which is still one that's really hard to live by, what other people think of you is none of your business. So, and I know it seems like it should be, but it's not, because that's their opinion. So don't listen to them, okay? Don't let them affect you. I know it can be hard because some people think they're so self-righteous. And like I said, I'll get into the personal aspect of that. There's one more thing. I did call this, and I have been calling this, the Mac Daddy of chronic pain. Now, Mac Daddy is not, it's a derogatory term if you go back to the origins of it. But it's also become known as like the thing. So, the top thing. So, again, not to take away from fibro. I'm going to stop saying that, okay? Because I can't keep saying that. But not to take away from other chronic pain or fibromyalgia, but CRPS has been kind of graded as the worst of the worst. All right. So it's like having a 2.3 earthquake versus a 5.1, which, by the way, happened today. 2.3 in Huntington, 5.1 in Malibu. It might be upgraded. I don't know. So, just talking about that. And that's kind of the difference, is that one, one, it's barely livable. One is just, when the flare up happens, it is debilitating. And it can happen through accidents. That's actually kind of how it starts. It can start with something as simple as, I was watching an article or watching a TV show a couple years back where this woman only had it in her foot. And what had happened was, she was one of the coaches for a football team. And one of the guys, I think she was one of the coaches, but whatever it was, one of the guys accidentally stepped on her foot with his cleat. And, of course, it was a pretty severe injury, because, a cleat spike is not not to be messed with. But it flared up. And so, there was a lot of suggestions on how she could take care of it, a lot of suggestions on how to get it back into remission. Older Sibling actually had a very devastating car accident when she was about 21 years old. The car flipped and rolled several times. Now, it didn't just develop right away. But, of course, Sibling has always been kind of level-headed. She's always been the one to kind of take control. And fortunately, the officer told her that if she hadn't, because he asked her, he's all, how did you do that? And she's all, what do you mean? He's all, for all intents and purposes, you should be dead. But Sibling was a horse trainer before all of this, really kind of upended and changed her life. And so she knew how to drive. We're talking old school. We're talking old school horse trailers. So she knew how to drive a horse trailer, and that actually helped her control the car long enough that it took a while before it started, flipping. So that led to her first experience with CRPS. Now, it got so bad that the doctors told her she would never walk again. And she was in a wheelchair, but Sibling is a very, very determined person, and she did walk. She does walk now. She's not super duper fast, and when she walks too fast, she needs to watch it because her knees can buckle. But, it took her a long time. However, she did go into remission for a while. But in 2005, she had very necessary spinal surgery, and unfortunately, that brought the CRPS back, and it brought it back full body. So one of the things that happens, I'm going to read the card in a second, but one of the things that I've asked her from a personal experience is, what is it like when this happens, because I can tell when she's flaring or when she's maybe kind of, because to me there's different levels of flares. There's some where she just turns bright red and she might just be flushing at that moment. If you're a woman, you understand what the flushing is. It's kind of like just like, when you feel embarrassed, when anybody across the board feels embarrassed and you kind of feel your face kind of flush, but it's whole body. But when it gets into a really bad flare, even in an animal's instinct is to take care of the person it loves, or to take care of whatever creature around it loves. And when she's hurting, the cats really want to be on her, especially George, which he's very, very attached to older sibling, but she can't even handle that. Even wearing clothes hurts her. It affects the nerve endings. It's like little tiny swords just poking at you really, really hard from the inside. I usually use the term ice picks, but I saw swords. But sibling also said that, it's like she's on fire from the inside out. So imagine you're at a bonfire or cooking at a barbecue, right? And you get a little too close to the flames and you're like, whoa, that's hot. Now imagine that's the inside of your body and you have CRPS. Now, in a lot of people, they call it complex regional because it can just be in certain regions, like the lady I talked about earlier who had it in her foot. Only like her foot and like the lower part of her leg, whereas sibling has it full body. So, it can really kind of upend your life. Now, when I talked about the opioid crisis, sibling had a friend who had an injury and they put her on opioids. It was just our classic run-of-the-mill injuries that we all get from time to time. They put her on opioids. She got addicted. So then, of course, she finds out sibling is on an opiate, and all of a sudden it's like, well, you got to understand, you're going to get addicted. You're going to get addicted. You're going to get addicted. And it got tiresome for her because she's not addicted mentally. Physically, yes. I mean, this woman grew up with a mother who was alcoholic, and I love Mom Barbara, and I know both of them have allowed me to share their stories, but she grew up with an alcoholic mother, and Barbara was sober in her later years. So, she got clean, she got help, and she lived the last couple decades of her life, clean and sober. But when I can't speak to this part of her life because I don't know what it's like to grow up with an alcoholic parent. But what she's told me is that she always watches the signs. When she first found out that she was going to be on pain medication, she fought it. She fought it tooth and nail. And the doctors were telling you, Laura, it's going to be unbearable. Just trust us. You have to trust us. And her and I talked about it. And I told her, I said, look, I've known you long enough now to know one thing about you. Sorry about that. To know one thing about you. You are not going to be addicted mentally. Physically, yes, obviously, because her body has to intake this. But this is a girl who, even in her worst flare-ups, she will not take a breakthrough med. And a breakthrough med is a lower version of the opiate, a different version, but a lower version of what she is already on. Excuse me. So this is somebody who will rather suffer through the pain, where I have to kind of convince her sometimes to take it. Not because I want her addicted, because she's, like I said, mentally she's not. Physically she is, but just to give her some relief. So it can be very mentally exhausting because you're fighting something, plus you're fighting, wanting to use something else that could potentially help you because of the past that you grew up in. So, when her friend started telling her all this stuff, she's like, no, trust me, I'm fine. And it got a little to the point where sibling actually had to walk away from that friendship. And she felt bad because she was really excited connecting with this person, but she couldn't do it anymore because every time they talked, this person just thought they knew more about her situation than they did. So when it comes to that, we have to be careful as people who aren't struggling with chronic pain to not judge the person. Listen to them, hear their story. Now, I'm going to tell you how this card came about, and then I'm going to read you the card. A couple years back, older sibling, I had the car. Well, I took her car that day. She can't drive a stick, so I took her car that day. And because it was, I think it was one of those things where it's like, we really, when you have two cars but one's not being used, you really want to kind of get both of them running. So I had her car that day. And again, like I said, she can't drive a stick, but we do have an ER nearby. So it was a very hot summer day. She didn't want to call her neighbor to ask her just to take her a couple blocks over. So she decides she's going to walk. And what happened was she had a tooth infection, but it's a Friday afternoon. The dentist couldn't get her in. So the dentist tells her, go to the emergency room, get some antibiotics. We'll try to see you next week. Okay, make an appointment for next week. And so she goes, and fortunately she called me by the time I got there, because she didn't want me to leave work. She just wanted me to know where she was in case I tried to call home and she wasn't there. So I left work. I came, met her at the ER. She was surprised. But I'm glad I was there, because I witnessed something that was just so disgusting on the part of a doctor that I was just appalled. I am not one to normally complain to a company, especially when it comes to me, but I was sending some pretty heavily worded, kind, not sweary words, but using some big words with this hospital about this doctor. So it was over 100 degrees outside. Like I said, sibling decided to walk there. So she's already flaring because of this toothache. All right. A toothache is causing a full body flare. She looks a little disheveled because it's hot outside. And this girl decided to walk a couple blocks to the ER instead of asking for a ride or waiting for me to get home. So the doctor takes one look at her before she can even say anything. And he says to her, I'm not giving you drugs. And she's all, that's not why I'm here. I have a toothache and I need antibiotics. And he says, I'm not giving you any drugs. And so I'm sitting there and I'm just, anybody who knows me knows I am slowly losing my shit. Because I know what she's going through. I'm very protective of my soul sister, very protective. And Mama Bear was starting to come out. Unfortunately, Mama Bear never got to say anything. But he just kept going and on and on. He's like, why don't you go to the dentist? And so I kind of piped in before, because she was just stunned. So, between the two of us, we both kept trying to pipe in, but she told him, she's all, the dentist told me to come here because it's too late in the afternoon to make an appointment with them to go see him. So, plus her dentist is in LA. So, he says, go to the ER. And he's like, well, I'm not giving you any pain meds. And she's like, I'm not asking for any pain meds. She's like, I have enough pain meds in my cabinet to put LA in a coma. And, she's not wrong. She doesn't use any of them. She only uses the ones that she's supposed to take daily. Okay. But she doesn't use the other ones. And so, it's just kind of like, yeah. So, but he was so adamant just by looking at her that she was only there for one reason. Now, I found out later that this particular hospital, I don't know if they still do because they've since switched hands and been purchased by a larger, actual big hospital nearby. But they had rotating doctors that would come in. But I was so furious. So I could see through the curtain. He goes to the waiting room across the way where the lady has rheumatoid arthritis. Sibling is trying to tell him, I have RSD, I have CRPS, I have chronic pain. I don't need the pain meds. I just need an antibiotic. And so I'm just like, when the doctor's walking at him, I'm like, are you kidding me? You're like completely useless to what she needs. But he walks over across the way to an older couple, and the woman has rheumatoid arthritis. First thing he does when he sees her, she's nicely dressed, because like I said, I'm sitting right there, I can see, oh, how are you today? What can I do for you? And then he's like, oh, well, do you need me to prescribe you like Percocet or Vicodin or something? And it's just like, are you fucking kidding me? You do realize that nicely dressed people can be addicted to pain meds. I'm not saying the lady with the rheumatoid arthritis was. It was a weird kind of day, so I think everybody was flaring. But the fact that he took one look at Sibling and just automatically decided she was there for one thing, that to me is a shitty doctor. And I am all for our medical staff. I have a friend of mine who's a nurse that's watching right now. I love her to death. I know she's probably the best. I know so many nurses. Half my freaking family is in the medical industry. But this guy is the first time I ever saw a doctor do that to someone in person. And I truly believe there was a reason for that, because even though it's years later, I am here to talk to the point that we cannot judge the person sitting in front of us. You know, if she asks for, something like drugs or something, I get it. But she didn't even open her mouth. The first thing he said to her when he looked at her was blah, blah, blah. And it's just like, oh my God. So I made these for sibling. I was so pissed off, but I wasn't able to say as much as I wanted to. I was to the nurse, and I tried to be loud enough that the doctor heard me. And, and the nurse was very empathetic. They really were. I think they were a little kind of shocked by how the doctor treated her. She did get her antibiotic. Fortunately, the nurse was able to write it and had the doctor sign off on it. But this guy, pow. So anyways, this is the card I made her. I have CRPS, complex regional pain syndrome, aka reflex sympathetic dystrophy. Doctors do not know why it develops or what causes it, but CRPS is a nerve disorder that usually occurs after traumatic injury, surgery, sprain, fracture, or a period of immobilization. The principal symptom is pain, dramatically disproportionate to the injury. CRPS can lead to disability. CRPS can spread through the entire body. Now, these are things that I wrote. Now, I wrote this card so that she could give it to doctors or to people that don't really understand. And she fell in love with these. In fact, when I handed them to her, I didn't mean for her to, but she kind of cried. Because, I think for once she felt seen. So I'm going to read this as if, the card is telling you, the card is the person itself, okay? My skin may swell, sweat, change colors, change temperature, or hurt to the slightest touch. I may look healthy, but I often suffer unbearable, unrelenting, and burning nerve pain. The McGill Pain Scale rates the pain of people with CRPS higher than that of people with cancer. Now, the McGill Pain Scale, I believe, is the scale that, they use, like, that little happy chart they show you, are you 1 or are you 10? I always tell people that when sibling is in a normal state, like she's not flaring, that she's probably an 8, 9, or 10. When she flares, she's off that scale. I mean, if you want to create a scale for it, after 10, put a house on fire. All right, that would be the 11 or higher. So the McGill Pain Scale rates the pain of people with CRPS higher than that of people with cancer. Now, we've seen how much pain people in cancer can be in. Your body's going through a lot. It's struggling. It's trying to fight something. The cancer's attacking. So, so see, Eileen's talking to what I just spoke about, the doctor. Hearing Laura's story at the ER just enrages me because it happens more often than not, and it's not right. I agree with her. It's not right. And I did, like I said, I went up to the highest person in that hospital. It's not my favorite hospital. Sibling has never particularly cared for it because every time she goes there, they miss her injury. She broke her hand. They x-rayed the wrong part, and she's just like, you know what? So I ended up taking her to the bigger hospital about probably a 15-minute drive away from here because they seem a little more, inept. But like I said, this hospital has since changed hands, so hopefully it's gotten its shit together. But anyways, okay, often it is difficult for me to sleep, so I may have trouble with concentration and attention. I may be taking powerful medications prescribed by my physician with many side effects that may affect how I feel or how I react. It is often hard for me to keep my body steady or to easily move. Chronic pain like that caused by CRPS often leads to depression because we undergo significant and often negative life changes. I have good and bad days. My pain may even change hourly. Stress increases my pain. Presently, there is no cure for CRPS. I always hope because of the support of my family and friends and ongoing research. Here is how you can help me. My pain is real even though it is invisible and may not be readily apparent in my demeanor or activities. I am learning various coping mechanisms to get through the day, but the chronic pain is always there, so I cannot predict how I feel each day. Sometimes it hurts to be touched anywhere, so please ask me before you touch me. It's okay to ask me about CRPS, or you can visit rsds.org and learn all that you can. So I think the first two on here really go to everybody with chronic pain, CRPS, fibromyalgia, you know, whatever, you name it, you put it on there. My pain is real, even though it is invisible and may be readily apparent in my demeanor and activities. And one of the things we can also attribute to that is mental health. You know, I've had, like I said the other day, I've had family members say, but you seemed okay. Well, I'm all like, yeah, it's because I'm an expert at fake it till you make it. So not anymore. I roll with my feelings the best I can, unless I have to. I try to save the fake it till you make it till unless it's absolutely necessary, and I've been fortunate. I have not had to do that recently. So, and then again, I'm learning various coping mechanisms to get through the day, but the chronic pain is always there, so I cannot predict how I will feel each day. We met a girl, Kelly, who runs, she does a lot of advocacy. She's the one that we invited us to the protest that she was putting together to talk about, pain medication, and how chronic pain users are struggling with the decisions made by the FDA and the government on regulating it. So, and it's hard because, everybody's trying to do the right thing. But while in the interim of trying to do the right thing by the people who are becoming addicted, they're forgetting about the people that actually need the meds. So it's been kind of a topsy-turvy thing. I think in the moment, Sibling's still getting her meds. So I think somebody has managed to figure it out and maybe worked something through. So I made these cars a few years ago, quite a few years ago. So, but when it comes to chronic pain, when I met Kelly, I met her at Sibling's pain management doctor. In fact, we were asking who the person was with the car that had all this CRPS advocacy on it. And the first thing I asked Kelly was, I'm like, oh my gosh, can I hug you? And I said, because I don't want to hug you unless, you're doing okay. And I'm telling you, she looked so shocked because she's like, oh my gosh, nobody ever asked me that, that doesn't know. And I said, look, I'm in a pain management office. That's the first thing I'm going to ask. But I have learned over time, like, is it okay for me to hug you? I'm a hugger. I love to hug. But sometimes when I hug people, I have to kind of reel it in a little bit because I don't want to hurt them. I mean, I'm not a bear hugger. All right. But what I mean is that people with chronic pain, you just got to go in gently and go in lightly. And if, you're not sure, just ask them, may I give you a hug? So, or can I shake your hand? And because even that, believe it or not, can hurt during a flare-up. So the thing we have to remember, don't be like the doctor. Don't judge somebody right off the bat unless you know their situation. Well, even if you know their situation, don't judge them. I mean, an addict doesn't want to be an addict. They're just, they're just stuck in this ugly loop because trying to become unaddicted, trying to detox, that was the word I was looking for, unaddicted. In order to detox, I've heard, okay, I don't know, but I have heard and I've seen in movies of, true stories that it's some serious shit. It is some serious stuff. And it's not easy. And a lot of them they don't, they try to detox and it's just as painful and it's just as traumatic, And so that's why they, with Sibling, because she's in pain management, if and when, hopefully when she goes into remission, they will wean her. They will wean her off so that her body just doesn't go into shock and freak out. So I don't have much more on that subject, but I wanted to include, the chronic pain, the veterans' mental health, the CPTSD and PTSD in Suicide Prevention Month week that I've been talking about it now. And again, like I said at the beginning, I'm going to be moving CPTSD, PTSD, veterans mental health, and childhood trauma to, or even, if the things involved with complex post-traumatic stress syndrome, I'm going to be moving those to next week. So Monday and Tuesday, they will each get their respective days because I think it's important to really kind of break these down and give them the attention that they all deserve and not just try to squeeze them all in. So, but I wanted to do chronic pain first because, again, like I said, I wanted to keep the PTSDs together. I think that's important so that people can kind of understand and put it all together, whether it's a veteran or, trauma. So, I want to thank everybody for joining me today. Sorry for all the hand stuff. Like I said, today is already a very difficult day for me, but I hope I gave this topic, I hope I did some justice to this topic with my my brain squirreling in every direction. Like I said, CRPS is known as the suicide disease. And imagine, we talked about cancer patients the other day and the law that we have now in California, the right to die, that I also believe they have in Oregon, where I think was actually pioneered, where, and even in Europe, where if a person has chosen, like medically, that they cannot really, they're just tired of suffering and they don't want to die this horrible, icky, ugly death. They want to choose their time. Then, they have this option. They have to get written off, I believe, by 2 different doctors. So, that being said, it is something that has become a thing. I get it. I totally understand it. I watched my mom die, 10 years ago, and I saw how much pain she was in. And to be honest with you, the saddest day was when she went into a coma. But at the same time, it was kind of a relief, because you kind of hope she wasn't feeling that pain anymore, because she was in that process then of letting go. And I can't imagine what that's like. But imagine where you have, a disease where the McGill pain scale says that they rate the pain of someone with CRPS even higher than a cancer patient. So that says a lot. That says a lot, because cancer patients go through some pretty horrendous pain. And for chronic pain people to have something similar or even off the scale kind of pain, it gives you an idea of what they're dealing with on their day-to-day basis. And it can be life-changing. It can be life-changing. I mean, there's, right now, Sibling has been in such a full-blown flare that it's hard for her to do a lot of things. I mean, there's things that she wants to do. There's things that she would love to do, but she goes out and does something and then she's down for 2 or 3 days. So just resting. So it's, it's a lame cycle. It's an ugly cycle. And it's a loop that you just want to jump off of and just be better. So as humans, when we come across people with chronic pain on any level, let's be better people. We treat our cancer patients and our hospital patients with kindness and love and empathy. So let's treat our chronic pain patients with the same kindness, love, and empathy and compassion that they deserve. All right. So I hope everybody has a wonderful, wonderful day. Eileen, thank you so much for joining me. Again, I love our medical professionals. I do not love that guy. I do not love that one doctor. I do not forgive easily. So I don't remember his name. I think I blocked it from my mind, but I wouldn't say it on here anyways, because who knows? Maybe he got talked to. Maybe somebody said something to him. I don't know. But I do hope that he has learned from that moment, because that was pretty awful. Sibling literally went home and cried. She went home and cried because, I think that's every chronic pain user's worst nightmare, is coming into contact with somebody who won't listen to you, who's not hearing you and what you're asking and what you're trying to tell them you need. So she did. She went home and cried, and I am sorry, Sibling, if you watch this later, for sharing that. She's at physical therapy right now. But yeah, I was look, it's been at least 7 or 8 years and I am still really mad. So I know, let it go, Shell. I don't mean mad like I'm gonna run out there and hit something, but I mean it still brings up the ire, the dire ire in me. So anyways, again, thank you so much for watching, everybody. Have a wonderful, wonderful weekend. Well, yeah, because it's Thursday. Tomorrow's Aloha Oracle Friday. I know a lot of you don't watch Aloha Oracle Friday, so have a wonderful, wonderful weekend. If I do see you back here tomorrow's going to be fun, because Aloha Oracle Friday is going to be on Friday the 13th. So I hope to see everybody back here tomorrow that is interested. If not, I will see you Monday, again, 8:30 a.m. Pacific time, Facebook Live. All the appointments are done for the week, so I'm back to the 8:30 a.m. time slot tomorrow. And then again, Monday and Tuesday, I'll be picking which one I want to talk about, but it'll either be about veterans or trauma and mental health and suicide. All right. So again, have a great, great day, everybody. Thank you so much for watching, and I will see you either tomorrow or Monday. Have a great day.